Hi everyone. Yeah, welcome to my channel. My name is Sarah and I'm here once again with another video. It's good seeing you all. First timers, you're welcome on board. Yeah, so today I'll be treating the topic stages of labor. Yeah, stages of labor. Before that, I would like to encourage you to leave your comments. You can share this video with your friends, other people who would also want to, who it would be beneficial to. Yeah, you can add your comments, tell me how I can improve upon myself. Yeah, and whatever you want me to know. Lastly, don't forget to subscribe, so that you get notifications every time I do a new presentation and release it. You get a notification. Great. So stages of labor is really a simple topic, very brief. So we'll be out of here in no time. All right. The only thing that may prolong our stay here is a few explanations. And yeah. So let's get going. Why do I want to do stages of labor today? Yeah, it is good to study stages of labor, because it helps you to know what to expect during labor. Okay, so that you'll be in the limelight. We don't want you to not be in the unknown. Yes, at least know what you are expecting as you are in labor. Great. And this labor, we are talking about childbirth. At the same time, we'll be talking about the caesarean birth as well. The vaginal birth and then the caesarean birth. Okay, so that's what I'm referring to. Then it is also good to gain your cooperation, because labor is not an easy thing. Sometimes we are not able to understand why we are going through certain things, so we tend to give our caregivers very tough time. Yes, we are there for you. However, if you get to know, the stages of what you are going through, you'll be able to at least cooperate with your caregiver, be able to do what he or she tells you to do at each point in time. And it also gives you an assurance that you are safe, okay, that you are in safe hands, you are comfortable, and what have you. It helps you to even be actively involved in your care, so that you get to know what to do at each stage of the labor. So basically, that is why it is important for us to study stages of labor. There are a few terms I'll be mentioning. I think by now we should be familiar with some of them. I'll be saying things like the Lycor harmony is the same as the amniotic fluid. If I say vertex presentation, that is just the hospital head presentation of the baby. That is what we expect to see. If I say dilatation, it's just the opening of the cervix. In case you don't know what the cervix is, the cervix is just a gateway to the uterus. Okay, it's an opening, a very small one. It looks just like this, the tip of this bed, very small one. So that is the cervix, an organ, and it serves as a gateway to the uterus. It's open, it closes, or there's a mucus plug formed within the cervix to keep the contents or the products of conception during pregnancy, and then at the same time, during childbirth, it opens up for the baby to pass through. During menstruation also, that is where your blood flows out and then out through to your external vaginal canal. So I hope we know what the cervix is. So I hope these terms are not going to be that new to you as and when we move on. If you have questions, you can leave them in the comment section, and then hopefully I'll attend to them. Great. So what is labor? I'm talking about stages of labor. What is labor? Labor is just a process by which the product of conception are expelled out of the birth canal. Okay, and delivery can be in two ways. I've already mentioned that it's either vaginally or surgically. So vaginally, birth is associated with painful uterine contractions and accompanied by cervical effacement or dilatation. Whilst surgical is a whole different process. So we'll talk about the stages for vaginal birth, then we'll talk about the stages you go through for the surgical birth. Yeah, so I hope you get it. So labor can be normal or abnormal. That you should take note. Now, normal labor is a process where a living mature fetus, so it means that if baby is not living as at the time of labor, baby is not mature, yes, then it means you're not having a normal labor. So together with the placenta and its membrane, so if the placenta comes out and some of the membranes are also stuck in there, it means it's not a normal labor. Great. then the lipoamine are all expelled out of the uterus after 36 to 41 weeks of gestation of pregnancy, with the presentation being vertex. I've mentioned the vertex position already. That is my back here, and the process is also accompanied by no complications. I mean, there's no complications that accompanies the process. Then we say that you are having a normal labor. I hope you get it up to this point. So there's no complication to mother or baby, and everything, as I've mentioned, is normal. The weeks I said 36 to 41. So if it's not within, we are not really having, it's before we are having a preterm birth. Afterwards, we are having a postterm birth. That is not a normal labor. If there are complications to mother and baby, that is not a normal labor. So let's take note of these things. I hope we get it up to this point. Great. So let's zoom straight to the topic for today. There are 4 stages of labor. Yes, 4. 1, 2, 3, and 4. We'll talk about each stage one after the other. So the first stage is called the dilatation stage, and then it is the thinning and opening of the cervix. I've already explained what the cervix is. Now it is the stage where we experience a lot of, so I'm dealing with vaginal birth first. Yes, so there are 4 stages of vaginal birth. Let me say it that way so that we wouldn't be confused. For vaginal birth, we have 4 stages. I said we have stage 1, 2, 3, and 4. Stage 1, which I'm talking about now, is called the dilatation stage, and then it is the thinning and opening of the cervix. And I said the cervix is the gateway to the uterus. Now, it is the stage where labor contractions are more, and that is what helps the cervix to thin out, open up, that is efface, open up more and more. Yes, just so the products of conception can come in. So this is where you need to apply your coping strategies more and more. I think we'll talk about coping strategies when we get to coping with labor, signs of labor, and then coping with labor. Yeah. So it is the onset of true labor, and the cervix at this stage will need to dilate up to 10 centimeters. That is the first stage. Now this first stage is divided into 2 phases. We have the active phase and then the latent phase. The latent phase is when the cervix has only opened from 0 centimeters to 3 centimeters. And that is very gradual. That stage is really gradual. You feel like, oh my God, the world is coming to an end. But no, the world isn't coming to an end. It feels so prolonged because it's so gradual. Contractions are a bit minimal, getting to the highest levels. And then the active phase is when labor, the cervix dilates from 4 centimeters to 10 centimeters. We need the cervix to dilate up to 10 centimeters. So we have a skill. Midwife will always come in, your midwife will always come in, check up on you at the time of labor, with her fingers or whichever artifact she has to assess your dilatation to tell you that, okay, ma'am, you are 3 centimeters, you are 4 centimeters, you are 5 centimeters. Immediately she tells you you are 4 centimeters, 5 centimeters, it means you are in the active phase of labor. And that is where the contractions, that the painful rhythmic contractions or abdominal uterus muscles are just stretching and tightening. That is contractions. That is where they become stronger, and then they are closer in succession, so they don't really keep long. If you take 10 minutes, in 10 minutes at the active phase, you could get like 4 contractions in 10 minutes, lasting longer for like seconds, 40 seconds, 60 seconds, and what have you. Yeah, and it's more painful. You don't get to rest enough at that stage. So that is the first stage of labor. That is the thinning out stage, or the dilatation stage. That is the thinning out of the cervix, or the opening of the cervix. And we said it can be gradual at a point and then closer in succession when it gets to the active phase. Now, we have the second stage being the pushing stage, and at the second stage, that is where the cervix has fully dilated up to 10 centimeters. Yeah, up to 10 centimeters, and then that is where baby needs to come out. Yes, cervix has already dilated, so baby needs to come out, and that is what demands us to push. That is why we call it the pushing stage. Yeah, so the cervix is it starts from where the cervix is fully dilated, and then it ends at where the baby is fully brought out of the birth canal. I hope you get me. Yeah, so it is at this stage that your midwife will tell you, position you, and tell you to push, ma'am, give me a push, do this for me, do that for me, rest here, don't do that. So like I said, it begins after the cervix is fully dilated and ends immediately the baby is finally out. Okay, it is literally the birth of the baby. That is what we call the second stage or the pushing stage. Yeah, so basically that is it. Now, right after baby is brought out, it takes us into the third stage of the vaginal birth or labor. Yes, and third stage of labor begins when baby is brought out to when the placenta and all of its membranes and other stuffs are brought out, and also to arresting of hemorrhage. Yes, some of us may end up bleeding a little after birth or even a lot. So the third stage ends only when there is arresting of hemorrhage. That is, we have stopped blood flow, mother is well, baby is well. So if baby is brought out, mother is brought out, mother is not well, baby is not well, third stage hasn't ended. I hope you get it. If the placenta is brought out, yes, so mother is bleeding and bleeding and bleeding, the third stage hasn't ended. The third stage only ends when there is a period of stability. Okay, yes, that is it. So that is if there's a period of stability after birth. That is the stage where your midwife and your doctor will be doing a lot of things to you. They'll be giving you injections, they'll be resuscitating you with medications, fluids, just to keep you stable. That is where baby will be suctioned, cleaned, a whole lot of things done to baby just to keep you and baby stable. So that is the third stage of labor. Great. So it is just to keep or take mother and baby to a period of stability. And I said it only ends if there is an arrest of hemorrhage and mother and baby is fine, cleaned up, and what have you. I hope you all get it up to this point, and I hope that you are enjoying or getting the clearer picture of all that I'm talking about. Now we have the fourth stage. So after the third stage leads us into the fourth stage. At this stage is the continuous monitoring of the mother and baby for a period of 6 hours and even beyond. Yes, after birth or after the period of stability, after when mother and baby. So this is where you are likely to be transferred back to your room of care after giving birth, vaginal. After you have been cleaned up and everything and mother is fine, you are moved straight back into your room and then to continue monitoring. So this is where the midwife or the doctor comes in to ask you, Mom, are you bleeding? Can I check your blood pressure? Can I check your temperature? Can I check up on you and baby? Are you suckling? Is baby suckling? But this is where we are taking through how to suckle and teach baby how to put baby to breast. These are the stages where midwives will always come in to check if your uterus is contracted and then everything is okay. Yeah, so basically that is the fourth stage, and the fourth stage continues till you are even more stable, and then observation continues until we know that you are not at risk of postpartum hemorrhage and what have you onto discharge. So that is the stages of labor for vaginal birth. Yes, I said the first stage begins after the arresting of hemorrhage or after the period of stability, continued for 6 hours after birth, and even on and on. And we still observe the woman and baby for a very longer time to make sure that there is more stability. Okay, it is just a continuous vigilant observation of the client. Okay, because we do not want you to have postpartum hemorrhage and be at risk of other stuff. Great. So some of us may end up staying longer at the facility even after birth. Some of us may stay shorter because we get stable. It's all differential as per a client. So don't get worried if you are, kept long or shorter. Don't get worried. You are in safe hands. Your care providers, know how well to take care of you. So I believe that getting care from a facility is also very key. Great. So that is that about the stages of labor for vaginal birth. Now let's look at what you also go through when it comes to surgical birth. For surgical birth, the case or the delivery mode is a bit different. Okay, the delivery mode is just surgery. So you are prepared for theater, then you are laid on theater, and then after theater. So we call the stages preoperative, stages. We have intra or perioperative stage and then post-operative stage. So that is a pre-operative stage, intra or perioperative stage, and then post-operative. So pre-operative is when you are prepared for the surgery. Yeah, so a lot of things will be done for you by your nurses and your doctors. I mean, when it comes to psychological care, when it comes to preparing you physiologically in terms of feeding, shaving, and other stuff, changing into the right clothing, spiritual preparations are even done for you, and what have you. All those things goes into pre-operative care. You sign consent forms, make sure that your staff for receiving baby and other things are ready. That is pre-operative stage. You'll be taking through all that by your healthcare provider, making sure all your medications and other stuff are readily available for the surgery. Then you have the intra-operative care. That is the care given to you during the surgery, while the procedure is ongoing, while the CS, the cesarean section, is ongoing for baby to be taken out. So you have your anesthesiast or your anesthetist around, I mean, passing on their staffs to you. I mean, they clean you, do a whole lot, all the care given to you, okay, whilst you're on the theater table is referred to as the intra-operative stage or the perioperative stage. And then the post-operative is after the operation, okay. Yes, there are a lot of things that are also recommended for you or done for you post-operatively, just like we monitor a mother who has gone through vaginal birth for a period of 6 hours and what have you. So the post-operative stage is more like the fourth stage, where you are taking through some protocols. Let's say meal per hours, you don't eat for some time, you don't get up for some time, your bladder is emptied, your BPs are checked. I mean, you are also monitored. Breastfeeding starts, SIPs, removal of cartridges, and what have you. So basically, that is the stages of labor for both vaginal birth and then surgical birth. I mean, be encouraged that you are in safe hands. Know that you are in safe hands. Every mother is different. Every labor process is different. Every child is different. So kindly be in the known. Be in the limelight. Do not be in the unknown. And that is why this presentation is key for you. So I hope you learned something for today. Great. So I'd like to thank you so much for coming on board to take your time out and listen to me talking about stages of labor. Yeah, thank you so much. I hope to come your way with another time.